My name is Al Benson. I'm a GI medical oncologist and professor of medicine at Northwestern University in Chicago, Illinois. One of the treatments that is available for patients with neuroendocrine tumors is referred to as peptide receptor radionuclide therapy, otherwise known as PRRT. In essence, this is a very targeted form of radiation therapy. And currently, the radionuclide we are using is lutetium-177 that is attached to dotatate. So for people who are candidates for PRRT, they must have positive somatostatin receptor scintigraphy, which is a nuclear medicine test, a scan, and the one that is perhaps more widely used currently, and there are others, is the gallium-68 dotatate PET scan. And the principle behind this is that for people who have somatostatin receptors on the surface of their tumor cells, a gallium-68 scan can pick these up. So what that scan is, the dotatate, when given, if the receptors are present, will latch on to the receptor. And the gallium is what we call an imaging dose of radiation. So the dotatate carries the gallium to the tumor, and then our scanner can pick up the tumor. With lutetium-177 dotatate PRRT, it's a similar principle. So the lutetium is attached to the dotatate. The dotatate travels to the receptors and latches on. And in this case, the lutetium is delivering potent radiation directly to the tumor cell. And this is a unique situation in medicine where we actually have a very specific imaging modality which can define the application of a direct therapy to the tumor cell. And this technique, by the way, although recently now commercially available in the United States, is a technique that has been utilized for many, many years. So what we do know, it can be highly effective. So the general way this is given, and this is a question people ask, what is the process for this? So most individuals who are candidates for PRRT are receiving somatostatin analog monthly injections with either octreotide or lanreotide. So to receive their PRRT 1 month from the last octreotide or lanreotide must elapse because we want to maximize the tumor cell receptor availability for the PRRT. So in nuclear medicine, what happens is an IV is placed and people receive a 4-hour amino acid solution. This is important because the radiation therapy that is administered through the lutetium can travel through the kidneys, out through the urine, and by giving the amino acid infusion, we help reduce that exposure of radiation to the kidneys. And this is administered for 4 hours. We also have to give people anti-nausea therapy because this amino acid solution can cause nausea. 30 minutes after this amino acid infusion has begun, we administer the lutetium-177. It takes 30 minutes to administer. The way this treatment has been designed is we give a treatment every 8 weeks for a total of 4 treatments as the initial program. People who have been receiving octreotide or lanreotide most typically continue that therapy. So after the lutetium-177 is administered, people can then get their octreotide shot and continue the monthly shots. But as I mentioned, there must be at least 4 weeks that elapse after the shot before we would give the lutetium. This treatment is remarkably well tolerated for most individuals. People who experience nausea that generally do so during this amino acid infusion. There may be some nausea after. It's generally readily controlled with our anti-nausea drugs. People can feel tired after the treatment. For most people, that might be about a week or so. There are some people who might have some abdominal pain and diarrhea. There are individuals who can have a decrease in their white blood count and or platelet counts. We monitor those, and I have had some individuals who have not been able to receive all 4 treatments because their counts have been on the low side. There is a very rare risk of effects on the bone marrow with either what's known as myelodysplastic syndrome or even leukemia. Fortunately, this risk is quite low. And one aspect in terms of kidney function that we've noticed is that by using this amino acid infusion, it appears that people do not have a harmful effect to their kidneys, certainly in the vast majority of cases. So this is an important treatment. We've seen some really excellent results in controlling patients' neuroendocrine tumors. And this is certainly a consideration for people who have been shown to have somatostatin receptor positive tumor cells.